Hello, welcome back. I'm Adam Rosen. So you've seen in some of my other videos, and if you haven't already, look back at what is a knee replacement, and we go into all the details with the knee model of what an actual knee replacement is. But unfortunately, some of you may need a revision. And a lot of patients aren't really sure, well, what is a revision? Like, what actually happens? So when you have a knee replacement, the way that I like to think about it in a simplistic way is, if you've ever had a cavity, a crown, a root canal, if you've had a crown, your tooth is still there. They've shaved some of the tooth away and they've capped it. Think of that as a knee replacement. Whereas if you have a revision, and a revision is like an implant. So we're actually getting rid of the tooth, drilling a post into the bone, into the jawbone, and then the crown or fake tooth is then attached to the post. So it's anchored in the bone above where the tooth is. So that's sort of a simplistic way of thinking about it, but there's lots of kinds of revisions. So the most common kind of revision sometimes is just that the plastic bearing wears out. If you've had a car for a number of years and the brake pads have worn out, you don't get a whole new car. You just take it in, they take the wheel off, they replace the brake, the rest of the car still stays. So if you've had a knee replacement in for a number of years, if that plastic bearing has worn out, we can go in and pop out the plastic liner and put a new plastic liner in. It's still a big deal. It's still a surgery, so it's still a revision. I tell my patients think of it more as a soft tissue procedure because we're not working on the bone anymore. And it's still a recovery, though. It's still a procedure. It's still a surgery. So don't think of it necessarily as a little deal, but it's a lot smaller of an issue than having a big revision. Now, what if you have an issue with one part? So sometimes one part can be changed. So if the thigh bone part were to loosen for some reason, or the shin bone part were to loosen for a reason, you can go in and change that one part. So let's say the thigh bone part loosened, you can go in, if the shin bone part is stable, is remove the thigh bone part and re-prepare the bone and put a new thigh bone part on. And I'll explain exactly how that's done in a little bit when we talk about revising the whole thing. Usually the plastic is changed at the same time because if the knee's been in there for a while, you're staring at it, you're there, you might as well take the old plastic out and start over from scratch and put a new plastic bearing in. But if the shin bone part was okay, you leave that. And again, if the shin bone part loosened, you might go in and just change the shin bone part. Sometimes that can be harder because just to get the shin bone in front, it can be hard to manipulate the leg. So sometimes surgeons will talk about changing everything, especially if the implant is of an old design. Sometimes designs have changed and you may not have all the parts for an old knee that was put in many years ago. So if you don't have all the options that you might need, even though one part is still well fixed to the bone, you may have to remove it so you have all the parts that you will need to replace the knee at that point and revise it. Now, if you have an infection and need revision, that's a whole different topic, and I'm going to do a whole video on that in case you get an infection or know somebody with an infection to kind of go through what the different steps are of treating a knee replacement if it gets infected. But here we're just generalizing, talking about knee revisions. Now, the bigger thing, and this is where I want to talk about like what actually happens. So if for some reason the implant failed, and maybe you had a fracture. So if you had a fracture and now the implant is loose, we have to fix the bone, whether or not the fracture was on the shin bone or the thigh bone, and then address the other parts. And as long as the bone is reconstructible, we can revise it with fairly normal revision parts. Occasionally, and this is more for people if they've had a horrible fracture, the bone is just shattered, we can do what's called a distal femoral replacement or a proximal tibial replacement, where you're literally replacing like a whole chunk of the bottom of your leg and ligaments with metal. It's not a super functional device because the thing is bolted together. It makes up for the lost ligaments and all the lost bone. But it is a solution to a problem, which is a terrible problem to begin with. When we talk about revisions, I'm going to talk about more your full revision. So this is, let's say, assuming you've had the knee in for 20 years, the plastic's worn out, and it now has led to a loosening of the thigh bone and the shin bone part. So a lot of times we'll see losses of bone. Think of it like cavities in your teeth. So you got little holes there, and now that's lost the anchor point of that thigh bone and shin bone part. So now we're revising the whole knee. So we go in, and although it looks loose, sometimes it's not completely loose. So once we go in, we have to clean out any debris and then use instruments to tease the implant off of the bone, wherever it's still attached to. And you can remove the thigh bone part, and you can remove the shin bone part. And now, when we first went in, we were looking at cartilage and you flattened it. Now you're usually looking at like an open hole or a crater. It tends to look almost like a trumpet, and you're looking down this huge cavity. And we have different ways of filling those cavities with cones or sleeves, but in some form or fashion, we have to restore where what's called the joint line is. So we have to figure out where your normal joint line used to be when you would bend and straighten your leg. And once we've done that, we can figure out how much bone you've lost on the end of the thigh bone, on the inside, on the end of the thigh bone, on the outside, behind the thigh bone, on top of the shin bone. And we can make those areas up, the places where you've lost bone, with pieces of metal, what we call augments. So we're basically putting together this tinker toy set of where the thigh bone would sit, and where you've lost bone, we're putting on these pieces of metal to fill those voids. But again, if you put the thigh bone part on the first knee or the shin bone part on the first knee, it's solid. It's a nice solid portion of bone. Now you have all these holes and cavities. So the fear is if you put those normal knee replacement parts on, there's a lot of wiggle room, and that may lead to an early failure. So in a revision, this is what I talked about earlier, think of this as a tooth implant. So what we then do is prepare the upper part of the thigh bone or the top of the shin bone, and we allow us to put a stem in. So if you have the shin bone part with a little post, for a normal knee replacement, you might have a bigger post for a revision. And that thigh bone part, which caps the end of the bone, attached to the inside of it is a post that comes out. So now when you anchor the post and the end of the thigh bone onto the end of the thigh bone, it's anchored above and below, and that gives you more stability. You can either what's called press fit it, where we determine the size of your thigh bone and the shin bone, and then there's a piece of metal that gets wedged in there, or you can cement it, where we actually fill that hole with cement, and then the stem gets placed inside it. At the end of all of that, just like a normal knee replacement, we have to determine what the thickness of the plastic insert is. So you put the new plastic insert, which is the new bearing, and then close everything up. And then the rehab tends to be very similar, almost identical to what you would go through for a regular knee replacement. But that just sort of in a nutshell gives you an understanding of the different styles or kinds of knee revisions that we do and that we can do them. I still have patients that they were told by friends or family members, oh, you can only have it once. You can never have it redone. You don't want to have it redone. We don't like to have you go through that. But if something does fail, it is fixable, or it is replaceable, or it can be revised. So that just is something that you can take into the discussion if you have a sit down with your surgeon, if you need a revision, and it may help you have a better understanding of what they're going to explain. But again, most commonly, plastic is worn out. We can pop the plastic out, put a new plastic in. If one part is loosened, you can replace just the one part. But if both parts have loosened, we have to re-prepare the bone. We can build up voids with cones or sleeves or augments. These all get attached to the implant or placed in the bone so the implant can fit through it. And then those implants with now stem attachments. So these are anchor points in good healthy bone above and below the knee joint, in the thigh bone and the shin bone, can either get wedged in there, what we call press fit, or cemented in there with a bone cement to hold it in place to allow you to get back up to walking and standing and hopefully fix the problem that you've been dealing with. So thanks again for tuning in. I'm Adam Rosen. Until next time, stay safe.